Hello everyone. So today we'll be discussing about chapter 10 disease of respiratory system J00 to J99 U07.0 medical coding interview based guideline preparation. So this video in this I have clearly explained like how you need to answer the guideline question for this chapter. Okay, so let's get into the video. COPD and asthma, ICD-10-CM guidelines simplified. So in COPD and asthma, we have acute exacerbation of chronic obstructive bronchitis and asthma. For COPD, we have category of J44 and asthma is J45. And it is differentiated by uncomplicated cases, acute exacerbation, lower respiratory infection. What is acute exacerbation? Worsening of infection is called as acute exacerbation. So COPD with acute exacerbation, you will be giving J44.1. Whereas asthma with acute exacerbation, we have 4 different category, that is mild intermittent asthma or mild persistent asthma or moderate persistent asthma or severe persistent asthma with acute exacerbation. The type of asthma should be specified. And coding of COPD and asthma, this is a very important guideline. You will code COPD J44 as a primary code when COPD and asthma is given, and asthma will be coded as a secondary code only if the type of asthma is mentioned. If the type is not specified, don't give asthma as a secondary code along with COPD. Next is acute respiratory failure, when it should be given as a principal diagnosis. Acute respiratory failure J96.0 should be given as a principal diagnosis only if it is a main reason for admission. There are no other condition like pneumonia, sepsis, etc. taking the priority, and no specific guidelines like pregnancy, poisoning, HIV is applying along with this. Then when acute respiratory failure can be given as a secondary diagnosis. If another condition like pneumonia or sepsis is a main reason for admission and respiratory failure is also present along with this condition or it is developing later, then the reason for encounter, the condition should be the primary diagnosis and respiratory failure should be the secondary diagnosis. Next comes influenza due to certain identified influenza virus. For this we have J09, J10 and J11. J09 is influenza due to certain identified influenza virus. Like it is used when the flu is caused by novel viruses like avian influenza or swine flu. J10 is influenza due to other identified influenza viruses and J11 is unspecified virus. Next comes ventilator associated pneumonia. We use J95.851 for ventilator associated pneumonia if it clearly documents that pneumonia is related to mechanical ventilation. And if the organism is specified, the second code should be given for organism. Here one thing you have to note, no need to code pneumonia code. And the next guideline, a patient is admitted with pneumonia, underline, and then develop ventilator associated pneumonia. So here the reason for admission is pneumonia. So the primary code we will give for streptococcal pneumonia. And second, they are telling like later the patient is developing ventilator associated pneumonia. So second code we will be giving for ventilator associated pneumonia J95.851 and third for the organism. Finally, vaping related disorder. Vaping related disorder refers to the lung injury or other health complication that results from the use of e-cigarette or vaping products. It includes wide range of conditions such as pneumonitis, respiratory failure, chemical irritation, etc. So first you should code for vaping related disorder U07.0 and second code for any related condition if it is present. So that's all for today. Thank you so much for watching. I hope this session helped you to understand the key guidelines and boosted your confidence for medical coding interview. If you found this video helpful, don't forget to like, share and subscribe. And subscribe Learn with Danya. Are you preparing for your medical coding interview and need personalized interview guidance or placement support? You can feel free to contact us. Thank you so much for watching. And if you have any queries or any doubts or if you need any interview based help like any guidelines or any questions need to be discussed, you can share it as a comment. Thank you so much.